So some of you have heard me talk about this so often that I'm a bit worried about giving this talk, and I'm sorry if I sound like a broken record. I'll also try and show some new things. But I guess the main message that I want to take away from today is that none of us are suggesting that exercise is a cure for everything, but it is a fantastic therapy, and we really should be thinking about it as a medicine to help you to optimize your physiology to be the best it can. And as you've heard today, there's enormous variation in potential. We had one mum posting that her kid is like a competitive high-level elite basketballer, but we all know that not everybody's going to be able to do that. But there are a number of unique reasons why exercise is probably more important for people with a Fontan circulation than it is in most other cardiovascular conditions. And if you thought about, a drug that could improve exercise capacity, could improve your mental health, your quality of life, your sense of well-being, your body composition, how well you'll do in the long term, your cardiovascular function, we'd think that was a miracle drug. And, there's data to suggest that exercise can do all of these things when you have a Fontan circulation. This is my dad, John. It was his birthday yesterday. We're having a birthday dinner for him tonight. And he was born in 1952. He's eating some sponge cake that my daughter Clementine made him that he said was too dry and not as good as his mother's. He's also a bit clueless. But it's incredible to me to think that 1952 was the year that the first successful open heart operation was performed in a child. So in my dad's lifetime, we only started doing an operation for hyperplastic left heart syndrome in the early 80s. So that was after I was born. And then, we've really evolved in our thinking about people with complex congenital heart conditions from how do we help this child to live a few more years to how can we help these people live and thrive into adulthood. And our focus has shifted to thinking about whole of person health. And you can see here that there's been an enormous surge in research in exercise as our knowledge has evolved and as we've started focusing on this really pioneering patient population. And up until sort of in this early era, really the focus was on restricting exercise. And many of you, especially the older people, would have heard, and you've heard people say today that, they were always told not to participate in exercise. And really now we're trying to focus on how can we help you to participate. It's not about restriction, but the level of participation, how hard you can push yourself is really individualized, and we'll talk a little bit about that today. So people who have a Fontan circulation, their body functions with just one heart pump. So in a usual circulation, there is a heart pump pushing blood in through the lungs, but in the setting of a Fontan circulation, there is no heart pump to force blood through the lungs. And that circulation relies on really unique forces. So the lungs are very important. When you breathe in, blood is sucked into the lungs. And then when you breathe out, blood is pushed out of the lungs or squeezed out of the lungs into the heart. A healthy heart function is important because that helps to have low pressure while the heart relaxes and for the blood to flow in. But the other important force is muscles. So if you think of the muscles kind of like a sponge, when we contract the muscle, all that blood is squeezed out of the sponge and pushed up through the blood vessels and up into the lungs. And this is a picture of blood flow in somebody with a Fontan circulation. And when they breathe in, there's blood flow, and when they breathe out, it stops in the veins, and then when they breathe in, the blood is sucked in again. Oops, sorry. When you exercise with a Fontan circulation, these little pulses here are little pulses of blood being pushed in. I've put the ECG leads on the person's leg so you can see when they start pedaling, and it generates little pulses of blood. It's being pushed in. So it's improving the blood flow and pushing blood through the lungs. It's also likely that that increase in blood flow helps the lung blood vessels and the heart to function better, which is something that we're researching and trying to understand at the moment. Many of you would have noticed that, especially when you were growing up as teenagers, that when you have a Fontan circulation, you tend to have less muscle and be a little bit leaner if you look at things like the leg muscles and the calf muscles. And even compared to other types of congenital heart disease, people who have a Fontan circulation tend to have reduced muscle mass. And of course, that's important when you're thinking about the importance of the muscles and the peripheral muscle pump in helping the Fontan circulation to function. And when we look at people who are healthy people with a Fontan circulation, a Z-score is a measure of how you compare to the population, and 0 is kind of considered to be right on the mean. And so on average, people are quite under the population averages when it comes to muscle mass. And that also appears to be the case in children. We've also shown in our research, and we've been doing a little bit of work with the team from the Mayo Clinic who have just published a really interesting paper showing that obesity has really negative impacts on the Fontan circulation, and that's probably for a number of reasons. If you think about the importance of healthy lungs and being able to expand and breathe out, obesity impacts the function of the lungs in several ways, and it also impacts how the heart can relax and draw blood into it. And we also know that in adults, people with a Fontan circulation are more prone to having high fat mass and low muscle mass, but you may not, if you're just assessing your body composition by simply weighing yourself on the scales, that will underestimate how much fat you have because it's outweighed by having the low muscle. So when we're doing our research, we do more detailed assessments of body composition using things like a DEXA scan. Many of you have participated in our research and would have known that we're assessing body composition in a more detailed way. And so we're not just focused on what's your body mass index or does your weight seem elevated on the scales. When we've looked at people who we follow in the Fontan registry, now I want to also acknowledge that I know some people find the term super Fontan upsetting because it's kind of implying that they're not super, and I'm sorry that we've used that language and that it's upset some people. What we mean by that term is there is about 10% of the people that we look after with a Fontan circulation whose physiology works very well, and they have a normal or even better than what would be expected for somebody with a completely normal circulation in terms of exercise capacity. So they've reached these very high levels of function. And when we've looked at that group of people, one of the most important associations or reasons why that seems to be the case is the amount of exercise they participate in, but it's particularly strong with how much they've participated in childhood. So the signals from the research are that participation in sport is very important in terms of maintaining exercise capacity, and it's especially important early in life. And there's a number of reasons why that might be the case, because the improved blood flow is helping the development of the lungs and the heart. However, I also want to highlight that it's difficult to know what's the chicken or the egg. This is one of our chickens, Florence. And I just like putting my chickens in talks, as many of you know. But of course, if we're just looking at research and saying, well, the kids who participate in sport in school seem to do better in the long term, That's also partly going to be explained by the fact that some kids are more healthy and aren't as sick as other kids, and so that probably explains some of that. So it's important that when we're looking at this research, that we're also trying to design studies where we, at the beginning, take a group of people, we give them a training program, and then we measure how does that impact their circulation so that we can follow them in the long term. And that's why big, expensive trials are so important, because we also need to be studying this properly, because a lot of things, when we're just looking back at data, might be confounded or complicated by other things. There's been a lot of interest after we published our paper looking at the people who seem to have very good exercise capacity. And there's also been a number of publications from other countries that have shown a really scary fall off in exercise capacity over the years. So when they just take everybody that they follow and they look and track their exercise capacity over time, a lot of groups from overseas have suggested that the people they followed seem to be deteriorating over time. And so we thought, oh gosh, well, we better look at that in Australia and New Zealand. But interestingly, when we looked at the people we're following, their exercise capacity actually went up over time. And I think one of the probable explanations for this is the fact that for about 10 years, we've been very focused on exercise here in Australia and New Zealand. And a lot of you have been hearing this information from your doctors and coming to education days. And we actually have a relatively fit and active population of people in Australia and New Zealand. And when we looked at this in more detail, one of the strongest associations in the people who increased exercise capacity over time was that they were doing exercise and that they were working hard to maintain their level of fitness. And in Denmark, they've been super interested in our exercise research for a long time and have also been really actively counselling their patients. And they've also found that the exercise capacity in the cohort of people they're following is also stable or actually improving over time. So I think education and also I can't understate the importance of family engagement. And I think Eve said this at one of our first education days, and he put up a funny like American poster and said, "That's not what you can do for your fontaine, but what you can do." Oh, whatever. But anyway, you some of you would have been there to hear it, and I'm very bad at accents. But I think that's super important, that there is things you can do. It's not all totally out of your control. Some aspects will be, but there are important things you can do to change and optimize your trajectory and health journey. And of course, it goes without saying that being active and participating in whatever activities you can is just so important for your well-being and confidence as well. So of all the non-invasive therapies, so medicines that's ever been studied in the setting of Fontan physiology, exercise has been shown to be by far the most effective. So, oh, and one little shout out. So there's a couple of studies going on. There's a study in Stanford at the moment. We're still recruiting for our exercise training study in Melbourne and Sydney and Western Australia up until February. So if you are interested and you haven't been approached, please reach out to us, because there's a small window, and probably by next year at Education Day, we'll have some results to tell you, I think at least some preliminary results about our big trial, which will be the biggest trial that's ever been conducted studying exercise training, to help us gather more information about how we can best prescribe it. So this is a very medical slide, but there's a whole bunch of contributors to exercise limitation in the setting of a Fontan physiology, and reasons why, like you've heard from Grace, that she might find it difficult to go on that huge 6-hour trek. And I've marked in red all the things that are potentially helped by exercise training. So the heart squeezing and relaxing function, body composition. So of course, exercise reduces the fat mass. It also improves the way that your blood vessels function and how your autonomic nervous system functions. It helps your muscles to be able to use oxygen properly and also increases the size of your muscle pump. And it can even help lung function. So it kind of is a bit of a magic pill. I made this on AI. And if you look carefully, like some of those unicorns are extremely wonky. But anyway, it was my first attempt at making AI pictures. Okay, so first of all, educate yourself, get knowledge, talk to your doctor and families. I can't emphasize enough that your child is not going to become a sports person unless they see you doing stuff and that you start those behaviors really early on. And this is one of our very cringy lunchtime sessions from a previous education day where we're sort of showing people some of the little exercises we do with our online training programs. So first of all, screening is really important. So as I've said earlier today, people who have a Fontan circulation are all very, very different, and there'll be different considerations in everyone. And rarely people will develop abnormal heart rhythms, particularly whilst they're sort of getting higher heart rates and pushing themselves. And so there are some screening tests. We don't do these in young children, but once people become old enough to undergo exercise testing, we usually from time to time, maybe every few years, we'll do an exercise test. We might need to do a heart rhythm assessment just to help us work out how hard, what's your optimal level of training. And we have published some guidelines as well. So it's helpful for exercise professionals to sort of access information, because as many of you will know, most other health professionals won't be familiar or comfortable with what a Fontan is at all. So on this table, this is lifted straight from our guideline that we've published. There are a few things that we take into consideration to help us prescribe exercise. So how is the heart muscle function? How dilated is the main blood vessel? Are there any narrowings to the outflow? How are the valves working? And what level of abnormal heart rhythm do you have? And are there any other considerations as well that might be contributing, like very low oxygen levels? And so this will help us to determine how intense we would recommend the exercise participation to be. I'm going to move quickly because we're all running a little bit behind schedule. Oh, I just wanted to do a shout out to Derek Tran, who leads my research group and has worked on a lot of this stuff with me over the years. Okay, so the actual exercise prescription. This is Evie, my very naughty dog. And we had a great time trying to take pictures of Eve with a pair of trainers on. The most important thing is that you enjoy it. You're not going to stick to something if you absolutely hate it. So one of the key things is trying to come up with things that you're going to stick with in the long term, because if you hate going to the gym, you're not going to still be going to the gym in 5 years' time. There's no hard and fast rules. I usually recommend that we try and do a mix of cardio exercises and resistance exercises, and a lot of things sort of incorporate both. I don't think a heart rate monitor is essential. In fact, I discourage it often. I think it creates a lot of anxiety. But depending on what your risk factor profile was, being guided by how puffed you are during physical activity is really the easiest guide. And for the majority of people with a Fontan circulation, we'll be encouraging them to exercise to a point where they're puffed out, but that they could finish a sentence. So you might be saying, so what do you want to have for dinner tonight? For the people who have a higher abnormal rhythm burden or some reduction in heart function, we might just prefer that they think it's a little bit safer for them just to take it down a notch and be not quite so puffed during their exercise. And we just start slow and we gradually increase, so that ideally for older teens and adults, we're doing at least 30 minutes, but ideally 45 minutes of mixed exercises most days of the week. But children should be doing a whole lot more than that. And Julian might want to make a comment about that at the end. So when I'm prescribing exercise, there's a few ways we can do it. We can sometimes even give you a little written exercise prescription, which has been shown in research just to aid compliance and sticking to it a little bit. And we talk about how long, how hard, and what types of exercise and how often. And there's differences in what happens to your body with different types of exercise training. So cardio or aerobic training, if you think of like those endurance runners that you see, they tend to be pretty skinny, and that tends to be the best form for calorie burning and reducing the amount of fat that you have. Also very beneficial in terms of risk for diabetes. It's a good medicine to help reduce blood pressure. It's also very useful to optimize the way your muscles function, but it's not great for muscle bulking. So when we're thinking about strength training, we're thinking more Arnold Schwarzenegger type. So that's going to help improve your strength, your power, your endurance, which is a big problem for people who have a Fontan circulation, with also important benefits. So in the olden days, people used to think of weight training as dangerous, and that it might increase blood pressure and increase heart muscle thickening, but that's all rubbish and been proven to be incorrect. But because of the importance of the peripheral muscle pump and having nice, big, healthy muscles for the function of a Fontan circulation, we do encourage a component of resistance training to try and build up muscle strength, particularly in the lower legs. And this is just a table of different sports, just to give you an idea. So if you move along horizontally, so the further along we move there to the right, those exercises have higher cardio kind of components. And if you move up, those exercises tend to have a higher component of kind of strength or resistance exercise to it as well. And things like swimming and jogging, they're a mix of exercises. And you can, for example, if you just like walking, we can always increase the intensity, and you can use little ankle weights, little cheap ankle weights from Kmart to increase the amount of lower limb muscle exercise you're doing while you're doing the exercise. So most people, we tend to want to be training around that sort of 14 to 15 level, but it's important that you've had some chats to your cardiologist and potentially some tests, like an exercise test, to help us to understand. Some of my patients love training in that more extremely hard range, and it's safe for them after we've done proper screening. But some of my people who have more serious complications, we might be wanting more in that sort of 11, 12, 13 range for exercise. I'll just skip over this just to save a little bit of time. So this is one of our fabulous participants in our exercise training program. And this is kind of a traditional way to do weight training. She was doing her 1 repetition maximum strength testing here, which is a way that we sort of titrate resistance training or strength exercises in the gym, where we get you to push your maximum, and then we aim to have you doing your training at kind of 70 or 80% of whatever your maximum lift was for that exercise. Now, it's really important, if you do have a Fontan circulation and are going to do resistance training, that you have proper supervision initially and are taught how to do breathing, because of that reliance in the Fontan circulation of breathing. If you do a big strain and hold your breath during a lift, it can cause very low blood pressure and be quite unsafe. So it's really important that you've been taught to take a breath in and slowly breathe out during the strain part of the lift. I can't emphasize that enough. But we can also do exercises using other ways. You don't have to have fancy gym equipment. For the study that we're running, we just use a thing called a gym stick, which costs $100, and you can use it kind of a bit like the lady in this. You can do all sorts of different exercises for your upper and lower limbs using just a simple resistance band. Or there's different exercises you can do at home. So in terms of how do you go about, and this is just, I just wanted to show you, this lady's participating in our exercise training program, and she's doing her calf lifts here and building her calf muscle. So we really love incorporating exercises like this in to build up the lower limb muscles. And this is one of our online training days during our study, and this is a gym stick and people are doing exercises. This legend is on the floor at work. He works in a bar, and he's, before they opened up, doing his exercise training program. And that's Emily, one of our trainers. That's the gym stick thingo. There's all sorts of stuff you can access now that's relatively inexpensive as well if you want to do this yourself. There's heaps of apps and lots of web content. There's wearables. I don't think wearables are important at all, but if you're a tech person, people find it motivational. I don't think we should be using these as a safety tool. And there's a whole range of different ways of exercise training. And for most people, unsupervised exercise training is absolutely fine. And the supervision aspect is really just to educate you initially and help keep you motivated. If you do want to access supervised exercise training, some of the bigger centres like Perth and RPA we've got exercise physiologists, and we're offering exercise training as part of our clinical services. In Australia, there's a thing that you can get through your GP called a chronic care plan, where you can get at least 6 Medicare rebated sessions with an exercise physiologist. And I often find that really important and can liaise with the community person just to get you started. But even if it's just, walking or dance classes or martial arts or, anything that you enjoy that keeps you active, there's really no perfect magical formula, in my opinion. I'll leave it there, I think. But thank you, everybody, for listening. Julian, did you want to comment about the children's stuff?
Yeah, no, I mean, it's more like 60 minutes or building up to 60 minutes, 5 times a week. But one question from the chat was around if you haven't had any exercise for a long period of time,
Yeah.
what would your recommendations be around, getting back into some?
Yeah. So I think being kind to yourself and starting slow is really important, and just having small targets like 10 minutes initially. And often, especially if you've had a period of ill health or an operation, really that's more of a rehabilitation program where you're trying to sort of recover from some kind of insult. And sometimes I think in those situations, having supervision and somebody to help motivate you is really helpful in that situation. But just starting slow and just gradually building over time, and anything is an achievement in that situation, any little improvement.
Great. Well, I'll just check the chat again to see that.
Oh, this is one for you.
Yes, a 4-year-old who's awaiting Fontan surgery. Is it okay to do swimming training and other physical activities? The answer is yes, most certainly. But as Rachel emphasised, just make sure that there's been a recent assessment with the cardiologist and that there's no kind of red flags, but that would be unusual, and mostly the answer is yes. Thanks, Rachel, and that's the end of the program for today.